Today we're confronting some of your most common and challenging health concerns to help you answer the question, am I at risk? Millions of women suffer from uterine fibroids or growths that can affect not only the menstrual cycle, even fertility. For those women, the treatment was often surgery, but now there's a new way to get rid of fibroids, and it doesn't involve a scalpel.
MRI-guided focused ultrasound is a breakthrough in fibroid therapy. What makes this treatment unique is that it uses focused ultrasound beams to precisely target an area within the fibroid tumor and selectively destroy that tissue without disturbing the surrounding healthy tissue. We have the women lie on the table throughout the procedure. The ultrasound is built into the table, and so you don't usually feel any of that. Under the belly is a pool of water, and through that pool of water, the ultrasound beams are targeted to destroy the fibroid tissue. So nowadays, having fibroids doesn't necessarily mean hysterectomy or major surgery.
So this is a great advancement for women's health.
This is exciting technology, but first let's go over what fibroids are for people who don't understand them. Fibroids are benign tumors of the uterus, and they just grow. They're cells that grow out of control in the uterus, and they can cause heavy bleeding, so much so that women need transfusions or the emergency surgeries that we've done in the past, or they can cause pain or fertility problems. So a long time ago, when we were just starting to figure out how to treat fibroids, well, they just take out the whole uterus. This is the uterus here. And, you know, that's a drastic cure. Then we, started to figure out that we can spare women some of these major complications with surgery by having less invasive techniques like myomectomies, which would just be taking out the fibroid. So I'm gonna show you an example here, like with a scalpel or with cautery heat, you would just take off the fibroid, and actually you sort of shell them out like zits. They have a capsule around them, and so you cut through that capsule and then you sort of just pop them out. They're actually very fun to take out. But anyway, and this technology is going to actually take away some of my fun, but it's better for women, and an option that every woman should know about if she has fibroids, because it's great to have options.
And joining us is the clinical director of the Duke Center for Fibroid Biology and Therapy, Dr. Millie Behera. So such obvious advantages to this versus surgery.
Absolutely. The most significant advantage is that we've gone from minimally invasive to essentially non-invasive. So there's no cutting, no stitching, no general anesthesia, and very little downtime, minimal risk of complications. So these women are usually up and about either the same day or the next day up to doing their usual activities and errands. So it's a huge advantage for women who don't want to take weeks to recover or to incur significant risk from other procedures.
Can you treat any fibroid with this technique, or are you limited to a certain size? Or?
There are some characteristics of the fibroid and for the women that you have to talk about. It doesn't necessarily fit every woman and every fibroid. There are certain size restrictions. We can treat fibroids up to 10 or 11 centimeters. We prefer that there be less than 6 fibroids at a time.
You have to treat the woman, with the right procedure. I mean, not every procedure is right for every woman, but you have with you Erin, who actually had this procedure done, yeah?
I am so happy that I was able to do something so minimal. I didn't want to take 6 weeks off of work. The next day I was back at work. It was an in and out procedure. I felt no pain.
That's fantastic. Every woman should know about this option, discuss it with her doctor, see if it's right for her. But it's a absolutely new cutting edge treatment for fibroids.
Erin, Dr. Behera, thank you so much.
Thanks.
Thank you. Up next, we've been teasing the surprising health risks you need to know before you go to the airport. We're going to tell you what it is and, more importantly, how to prevent it after the break.